Says we're live on YouTube.
We're good.
Are we good to go?
Yes.
All right. Good evening, everybody. We apologize for being a little bit late, some minor technical glitches. I'd like to welcome everyone to the August 13th, 2020 Committee of the Whole Board meeting for Lake Bluff District 65. Our board members and members of the district's administrative team are participating in a hybrid meeting as there is currently a requirement on group sizes in an effort to limit the spread of COVID-19. As a public body, the Lake Bluff Board of Education is subject to the Illinois Open Meeting Act. Prior to this meeting, a public announcement was posted on our website announcing various participation options, including asking questions ahead of time on the meeting asking questions ahead of the meeting using a Google form. While the requirements of Open Meetings Act have been relaxed during the global pandemic, the members of the Board of Education take their responsibility as board members who are responsible to the public no less seriously. Leanne, could you please call the roll?
Barry,
Present.
Marzen,
Present.
Haig, absent. Hill,
Present.
Duran,
Present.
Gotchall,
I just got a text for her to please resend the link, is what it said.
and Charlot present.
All right, so we have a quorum. We can begin. If you are live and in person, if you guys could stand, otherwise you could join us in saying the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We are going to offer public comment. It's on our agenda. It shows two opportunities for public comment, one before the presentation, one and one at the very end of the meeting, but I'm also going to insert an opportunity after Dr. Leali does her return to learn plan update, so that if anybody wants to wait until after the presentation, we will open it up for public comment. Prior to asking if there's anybody available for public comment, up front, I just want to remind everybody, as I will for the next several months at every meeting, that we have a school board election coming up in April of 2021. And we are going to be in need of 4 new board members. 4 of our veterans are going to be stepping down. And if anybody in the community is interested, we are looking for people who are interested in serving. It's very rewarding work. The thing you need to remember, though, is your paperwork needs to be filed with the county by sometime in December. So if anybody's interested, please don't hesitate to reach out to myself or anybody on the board to learn more about what it means and what is involved in being a school board member. Saying that, I would ask if we have anybody in the waiting room who wants to ask a question. Is there any public comment before we get in? I don't see any raised hands. Do you guys have anything?
There is one that was sent to us.
Okay, and somebody's going to read that for us?
Yes, Shelley's going to read it.
We have a public comment from Franklin Alvarez. I just want to thank you to all the board members for your hard work and dedication. I just want to let you all know that giving parents the option to send their children to school or do e-learning at home was a good decision. Thank you for understanding that some parents might be able to do e-learning at home while others might not have the same option. Thank you again. Keep up the good work.
Okay, thanks. Lisa, I've got a text and an email from Julie about resending the link for her. Okay.
We are doing that.
Okay. So now we're going to move on to the big item for tonight, and that's the Return to Learn 2021 update by Dr. Leali.
Thank you very much. I'm going to wait until the volume is down. Can you turn your volume down? Happy to be here tonight to provide an update on our planning and how things are going in terms of getting students back to school and getting students back to learning. So as we always do, we start with our mission and vision. As you know, this whole time we have been working to develop a plan for returning to learn this fall that holds true to what we believe about education, and that we are going to provide each student with quality instruction, opportunities, educational environments, inspire academic achievement, personal growth, and responsible citizenship, and that our vision continues to be excellence in education, enthusiasm for life for every student every day. I'm going to remind us of our decision-making guiding principles. As we have talked about, there have been many, many decisions that have had to be made throughout this process. There are many still to be made. And we have some guiding ideals and things that we think about always are top of mind. Number one, student and staff safety and well-being. That's physical, as well as the second bullet point, social emotional health of our students and staff. Obviously, we are looking at achievement and growth and wanting that for our children as we move into this year. We are considering equity for students, regardless of the logistical issues that they might be dealing with or their learning location or choice that they made at the beginning of this enrollment period. Continuity and consistency as much as we can possibly provide, and of course, support for our community. I would reiterate again that we are very fortunate to be in alignment with a village that understands the severity of this situation. And we appreciate that we are together in this effort to ensure that we are working together and having collective responsibility for safety and health. And what that means is that we are all taking personal responsibility wherever we go, wearing masks, watching our distance, and washing our hands. And our plan, of course, takes all of these pieces into account. And of course, this will be an evolving plan that is meant to address any issues that come up and all the needs of our students and staff. So what is being presented tonight in the update? One is an update on our task force that, as we know, has been vigilant and with us the entire time, kind of helping us through this process. I'll be giving an enrollment update in terms of the numbers of students who have chosen to be learning with us at school and learning at home, and those who have chosen the hybrid. I am going to be presenting a calendar adjustment for the first day of school, which will ultimately impact the last day of school as well. Just another update on the metrics that we're watching and some information that we have received this week even. I'm going to talk a little bit about a discussion that we started in our task force on creating feedback loops so that we can make sure that we are continually collecting information and gathering feedback from our community so that we can also be improving as we make decisions and as we go through this, and then also just present the community with some reminders and kind of requests for support as we move through this ever-changing and very dynamic situation. So as we know, our task force has been meeting since June, or actually since, I think it was June was the first time we met. So we've met 8 times. It is made up of board representation, our entire administrative team, parents and teachers. Our union president sits and vice president sit on that as well. The purpose of that task force is feedback and discussion. So for many of our meetings, we present information, drafts of information, and ask for feedback. We ask that task force to go out and kind of solicit feedback and bring it back to the meetings so that we can have open discussion and dialogue. It's been very helpful. And all those meetings, as we know, are recorded. They stream live and then are recorded and remain on our website if anyone wants to go back for those. And we will be implementing a new schedule for our meeting times. We've been meeting at 1 o'clock on Thursdays when school starts. We're going to shift our meeting time and possibly move to once every couple weeks, or just as we need to as we're moving through the school year. And we have some folks who are stepping down, so we may have some new membership opportunities. If anyone is interested in joining this group, it's a tremendous group and has been very, very helpful to our team. So as we know, we did give the community a choice for remaining at home for remote learning this year. And we did encourage remote learning at home as an option for families to consider strongly. The reason for that is that we knew way back when we even made this plan that the guidelines that we would have to be obligated to adhere to were going to make it difficult, if not impossible, to have all of our students back in the building every day, just based on space and our ability to, like I said, adhere to the guidance. So that was our recommended option, but we did offer an in-school option as well for students to come with us and participate in their learning at school. And at the beginning, when we sent out our survey to the community, we also asked about interest in a hybrid model, which the example we gave was 2 days a week in school and 3 days a week remote. And so we had a group in the community, a pretty large number, that expressed interest in possibly just coming to school for 2 days a week. And as we know, that hybrid option was always going to be based on enrollment and the choices that our community made in terms of where they wanted their students to be learning. When the numbers came in, we recognized that our numbers for in-person school were a little bit higher than we needed them to be so that we could keep everyone safe. And so we only offered the hybrid option to those families who chose to be in person at school so that we could reduce our numbers that are with us every day. And we have been able to ascertain a choice from most of the families who have participated in that survey and told us what their choices are. We recognize that this has been a really difficult decision for parents. Many parents have reached out, community members, to try to understand kind of what this is going to look like. And we thank you for your patience with us as we have also been trying to vision for this and make decisions about what this should look like while we're trying to create consistency between an in-school option and an at-home option. And we will work with families as much as we can to make this successful and a safe year, no matter what choice they made. So I just want to reassure the community of that. So in terms of an enrollment update, these are the numbers that we have right now. One line has been adjusted since I sent the PDF to the board earlier, and that's the pre-K, 2 lines. The pre-K 3 and 4 options have been updated. But these are the numbers as we can see. And so our administrative team has been working hard to assign staff to students who are going to be in school and students who will be learning remotely at home, and making sure that our facility is able to accommodate the students at a 6-foot distance, which is the guidance that we are obligated to keep. And these are our middle school numbers. And again, that is why we offered the hybrid option to the families who chose in school, because we really wanted to get those at-home numbers up a little bit so that we could make sure that we could keep everyone safe. So it's a good segue. The guidelines that we're trying to adhere to is a good segue into my proposal for a calendar adjustment update. Since our last meeting, as you probably know, many surrounding districts in Lake County have shifted to full remote learning, meaning that students would be out of school and learning remotely at home. And while I understand that this is definitely a decision that some districts have to make, given all the metrics that we're watching and all of the issues that we're confronting, it has created an additional issue for our staff because at this time, many of their own children will be also learning at home. And that was an unanticipated challenge for us to deal with in terms of the numbers of teachers who would have this challenge. And so we are working right now very hard to develop and refine a Park District partnership. They've been very great collaborators for us as community members, and they are building a program for our employees so that they can bring their own children to do remote learning at the Lake Bluff Park District. And that is a program that we're working hard to get up and running for our teachers. As well as, since the group has narrowed a bit in Lake County in terms of how many districts are actually trying to bring students back, us being one of them, we have added an additional articulation every week between our district and those other districts to ensure that we can be talking best practices and also communicating directly with the Lake County Health Department every week. So that has taken some doing to get an additional meeting with the Lake County Health Department, and we've been asking for some different metrics so that we can continue to monitor our situation. Another thing that's been happening, that continues to happen, and this was one of our assumptions, that the guidance would continue to change. So I'm just going to update you on a couple of pieces of guidance that will really affect our ability to sustain in-person learning. One of those pieces is that, and again, the governor defines the phase of Restore Illinois that we're in. We were currently in phase 4, and schools are able to reopen as long as we're operating under the guidance of the Illinois Department of Health and its subsidiaries. So for us, the Lake County Department of Health. And they have issued some guidance in the last couple of weeks and clarified some guidance for us that is really impactful in terms of our facilities. And that is that when a student presents with any COVID symptom, and we know now the list is pretty long, so if a student is exhibiting or complaining of any of those symptoms, that student needs to be evaluated quickly by our nursing staff and most times sent home. And the clarification that came to us this week was that they will be sent home regardless of underlying conditions present. So in the past, we were kind of operating with the thought that if a student had a documented medical condition that would cause them to display a symptom, that we would be able to document that and then use that as a reason to sort of, justify why that symptom might be happening. But of course, unfortunately, we don't know and we cannot diagnose when something is COVID and when it is not. So for example, if a student comes to us who has seasonal allergies and that causes him to have headaches and sneezing and coughing, we cannot automatically assume that just because he has seasonal allergies does not mean that he does not have COVID. So that student would need to be sent home and would not be able to come back without being evaluated by their physician. And the additional piece of guidance that was laid out this week was that not only would that student need to go home, but their siblings would have to go home too and be evaluated as well and be given a doctor's note to return to in-person instruction. Once that student who presents with symptoms does leave the classroom, then we also need to move the class of students and teachers to another alternate location until that room can settle down and we can disinfect about 24 hours later. So of course, in terms of facilities, that presents a need for us to have alternate locations every day available for students who may come to school with symptoms. And this is where, later on in the presentation, we'll talk about the community partnership that it is going to take for us to sustain this. We're assuming that parents are going to complete the daily self-certification and not send students that have any symptoms, but it'll probably happen. And so we need to have at least 5 rooms available, 3 to 5 rooms every day, so that we can have classes move to alternate locations when needed. We have encountered some enrollment challenges. The many options that we provided were great, but also some of our families had a hard time completing and making that choice. And so we have had a time kind of connecting with each family and making sure that they've made their choice in a timely manner so that we can start with staffing and room assignments and things like that. That process has gone a little bit slower than we thought it might. And an additional kind of reason for the need, a need for this calendar adjustment is that we have, as late as last week, found out that our supply kits are also delayed. We don't know when the company will be able to supply those. They're having some challenges with their delivery and staffing. And we also have some technology delayed. So the order was placed at a normal time, well in advance of when we needed to. But as we can imagine, the need for additional technology is pretty great right now. And so we know that that may not be coming until much later in the year, which we aren't going to be able to delay that long school, but we do need to provide some professional development and create some additional tutorials for our parents and families who will be having that to use different technology. All of our children will still have a device. It's just that one of our grade levels will have a different device. And so we need to be planning for that at least until we get our technology in. So for all of those reasons, we are going to be adjusting the calendar and the following is what it's going to look like. So we're going to keep our 4 institute days next week, August 18th, 19th, 20th, and 21st. 2 of those are teacher institute days. 2 of those were remote learning planning days. As we know, we have 5 from the state to allocate. We allocated 2 to next week. So we are going to keep those. And then we are going to move the last remote learning planning day to August 31st to give us a week in between when our teachers receive the professional development and have some time to articulate and talk with each other. For the buildings to be open, for teachers to come in and look at their classrooms, maybe set up if they'd like, participate in some more optional PD. And that will also give our administrators a little bit of time to make sure that our safety protocols are in place, that we have our classrooms and class assignments and our alternate locations all set and ready to go. So We are going to be changing the first day of school for grades 1 through 8 to Tuesday, September 1st, which is 1 week later than we had anticipated we would be opening this year. That means our pre-kindergarten screening will be Monday, August 31st, which is also on one of our remote learning planning days. So we will be completing those two pieces at the same time. And then our pre-K students will begin on September 3rd. And we are going to continue with the model of kindergarten screening that we started last year, I believe, with students being screened individually at school. And we will be inviting our remote learning students to do this as well, coming into school between September 1st and the 4th. And then our kindergarten students will start a week later than the 1st through 8th grade students on September 8th. That pushes our last day of school to June 10th. And then if we have to use emergency days, which quite honestly, I don't think we will have to, because snow days are, I don't think, going to be a thing anymore for us now that we have remote learning every day. But that is something we need to include in our calendar still as kind of a holdover from the way we've done things in the past. We would, if we had to, use those emergency days, extend out to June 17th, but I don't see that that would be happening. Within this calendar, we've also retained 3 of our remote learning planning days that ISB allows us to have. So we will have some flexibility in the middle of the year, should we need to shift entirely to remote or move back from remote to in-person or some kind of hybrid. So the extra week allows us, like I said, to make sure that we have our professional development complete, our teachers some time to plan, set up their classrooms, make sure that we are allowing our administrative team to complete the work that they need to make sure that the beginning of school is smooth, and to help give us some time to develop that park district partnership and ensure that our staff has support for their own child care needs so that they can be here for our students. And so that is the calendar update.
Lisa, can I ask a quick question?
Absolutely.
Just to refresh my memory, what was the prior schedule's first day of school for grade 1 to 8?
Tuesday, August 25th. So we are pushing it 1 week.
So 1 week back. Okay.
Yeah. And again, that week we will be doing some activities, which I will talk about in a minute, some other dates that we will be actually, I don't have it in the presentation, but that week of the 24th, we will be completing materials and supplies pickup. We will be having webinars, orientation webinars in the evening for both LBES and LBMS from the principal's perspective, so that we can get the parents some time to understand what this will look like. And on August 21st, which is a week from tomorrow, families will receive a welcome back letter, which outlines their teachers and some grade specific information. So that extra time gives us time to communicate. It gives us time to collaborate and plan and just make sure that we're able to be successful as we move into this school year. So as you know, this is a lot of work to plan for having students in person and at home. And we also know that there are a lot of metrics that we're going to need to watch to ensure that we are able to keep this going. As I talked about, one is for sure the Restore Illinois phase that we are in. The other is the positivity rate. The positivity rate is the number of tests that are positive out of the number of tests that have been completed in a certain area. We happen to be in Region 9, which is Lake and McHenry County. So Illinois calculates the positivity rate by region, and everybody can watch that positivity rate. They calculate a 7-day rolling average. And the threshold for increased mitigation is at 8% positivity. Right now, as of today, I believe we're at 5.6 or 5.7, and we've had, I think, a 6-day increase in positivity. So we are under the 8% threshold, but obviously as if we see an increase, we see a steady increase and we're approaching that 8%, we're going to have to consider moving into remote learning as a district. As I talked about, the small group of districts that are trying to bring students back are also articulating with the Lake County Health Department and asking them, and most superintendents are asking for this, not just ours, but some more zip code specific information so that we can make some decisions that are based more on local metrics. So we are lucky here in Lake Bluff because we only have one zip code that we pull from. There are some districts out there that pull from multiple zip codes. They're going to be doing some fancy calculations to weight and figure out positivity rates for their district. But obviously that when we are able to have that from the Lake County Health Department, that will help us with our decision-making as well. Another metric we're watching is our enrollment and our ability to keep a 6-foot distance at all times. And again, do we have enough rooms to implement isolation and cleaning procedures for every student that presents with one symptom of COVID? You know, when we start to, if we start to run out of alternate locations, or the ability to move students when this happens, that will be something that may shift us into a different situation. We'll be watching our PPE supplies and our safety measures. Do we have an adequate supply? You know, making sure that we have an adequate supply on any given day and continue to have the ability to purchase. So as we know, some PPE has been difficult to come by. We've been lucky with what we want to have. We've been able to receive. So we want to keep that up. And then obviously our staffing and the health and wellness of our staff and their ability to work with our children in person is one metric that is very, very important to us. Having a healthy pool of substitutes to help us when our teachers cannot be with us. And like I said, the childcare situation for some of our teachers, which is unfortunately causing them to have to really think creatively and problem solve a situation that's very, very difficult already. So any one of these metrics could cause us to have to shift, unfortunately, into a situation where we're all remote. But the plan we are building should transition us seamlessly into that situation if it should occur. And finally, like I talked about before, our team's been talking about, you know, regardless of where students are learning, regardless of us shifting in between and us, you know, watching all of these logistics, we really are dedicated and committed to making this a good year of learning for our students. It will be different than the spring, regardless of if you're at home or in person. It's going to look and feel different, but we still have the same goals. And so we are looking to create consistent ways for us to survey the community, to survey our students. And some of the big areas that we've been talking about are student and staff, emotional health and wellness, as we talked about. That's one of our guiding principles, you know, checking in with students and staff to make sure that they're feeling okay. Instruction and assessment, obviously we're having to redesign and rethink about how we assess our students and provide feedback. Whether or not our communication is effective, if it's enough, if it's too much, if it's not coming at the appropriate times. Our resources that we're using, and that would be online, but as well, or you know, tangible resources that we have students using to be doing their learning this year, and whether or not those are working. And then another big area is student connection to their peers. We know that this is has been a very difficult time for students to maintain connection with their peers. We know that that's one of the risks as we prolong remote learning for kids, is losing that connection. And again, that's tied to student emotional health and wellness. So we will be trying to actively seek information on whether or not our students are feeling connected to us as a school and also to their friends and community. So we will be and are asking for some help from the community. We definitely, for our younger learners, are asking if you are sending them back in person, some support with practicing basic skills, which if students come to us unable to do these things would make it harder for us not to maintain a 6-foot distance. So we're talking about tying shoes, zipping backpacks, getting coats on, those things like that. So the more independence that students can come to us with, the better. Again, we're asking for true self-certification. We'll be talking about, you know, how our certification process is going to work, and we need the community to really take that seriously. Lake County has lifted the travel ban restrictions on their website, but we know that hot spots for this virus are going to change. There's going to be, you know, popping up different zones of the country and of the world that are going to be more intense at any given time. So what we do ask, though, is when the students aren't with us or aren't with members of their household that they live with, that they're always practicing safety protocols, you know, that we try to avoid high-risk areas when we can. that we're wearing masks and maintaining distance and practicing good hand hygiene. And finally, we would just ask the community for your patience. We know that this has, again, been very challenging for everyone, and we know that it requires some patience and trust. I can assure you that we're working on building the best system we can possibly build to keep this choice going for our community. So as we talked about parent self-certification, we will be sending out more information on this, but again, a symptom of COVID are any of these pieces, any of these symptoms that a student might present with. We have purchased an app that parents will be able to download on their phones. They will need to self-certify their child, each of their children, before 8 a.m. We'll be sending text reminders around 7. And then we'll be running reports and calling parents who haven't self-certified by the time that they arrive. So, and if they come to us not having self-certified, then we are developing systems to screen them at school with thermometers and, you know, the infrared readers. And we'll send students home if they have a temperature of over 100.4 or exhibiting any of the symptoms, and that will be part of our daily process for students and staff. We will not, again, be conducting daily temperature checks unless a student hasn't self-certified or is reporting having symptoms. Again, anyone with any one of those symptoms will need to go home and be evaluated by their healthcare provider. We are not going to be having any non-essential visitors to our schools, just to try to, again, keep the numbers down. And so some of the in-person events that we love about the beginning of the school year will be remote this year. The administrative team has tried very hard to think through how we could offer in-person opportunities. And quite frankly, before we are able to talk with children about our safety protocols, even outdoor activities are going to be difficult for us to manage. And so we will be doing a lot of the first part of the year activities remotely for that reason. And we are asking and setting up procedures for our visitors when they come to the schools to maintain a distance or stay in our vestibules when they can. And that is something that we are working on the logistics of, and we'll send out more information prior to the start of school. Again, we'll be working very closely with the health department on any positive cases. And we need the community to really collaborate and talk with the health department. It's been brought to our attention that at times the health department calls for contact tracing or calls members of communities in Lake County, and family members are not picking up, are not answering calls, are not returning calls in an effort to avoid that contact tracing. We really need you to do that. We need the community to participate in that process so that we can keep everyone safe. And again, Lake County will be helping us as cases pop up and guiding our decision-making that way. And I'm going to turn it over to Jay to talk a little bit. We've talked about this before of how COVID is impacting our budget at this point.
Hello, can you hear me? So we are tracking separately. We've set up a whole separate chart of accounts to keep track of COVID-related expenses. We've purchased a significant amount of PPE to start the year, and as well as signage for the buildings, technology and internet access, and we're setting up our classrooms. Right now, I mean, it's still a very moving target. I'm estimating anywhere from $200,000 to $250,000 budget impact in COVID-related expenses for the year. That is exclusive of any big ticket items if we were to do some large scale testings or make additional capital improvements, but that is certainly a manageable number, and we're looking at saving money in other areas. So we will, but in the budget, it will just be issued on one line. So we'll be budgeting separately in that, instead of, because it's too hard to predict in what line items these expenses will come, you will see it broken out on the budget form as a contingency line. And then at every board meeting, the board will approve a transfer from that individual contingency line to the individual line items. So there'll be a lot of transparency, and you'll see exactly what the financial impact of the pandemic is costing.
So in closing, we do ask, again, for patience and flexibility with our team, and not just our administrative team. I can't tell you enough how proud as a board you should be of your teachers. They have been involved in this process the whole time, helping us and talking with us, presenting us with questions and concerns that they have to guide our thought process and to make sure that we are thinking through all the things we need to think through. They are professionals. They want to be back with our kids. They want to create a great learning experience. They are trying hard with us to envision what this can look like and to build something really amazing. And I think it's just a testament to the community and the investment that you've made in education, the tremendous educators who are here. So I again ask for that flexibility and patience from the community right now. We may have to make some quick decisions as we move through this together. And we apologize again for any inconveniences this may cause, just like the calendar change tonight. But we really do want to do the best we can for our kids and make sure that our staff is ready for them when they return, either with us at home or with us at school. With that,
Is it time for questions? Is it
Hi,
time-
John.
I have one question related
John,
to,
can you unmute yourself?
I can hear you, John. I heard you before. Now I can't hear you.
Oh, you know what? It was my fault, John. It was my fault. I didn't have my volume up.
You're still muted, John.
Yeah, you have to unmute now, John.
okay,
You're good.
okay. I have one question related to the public health county metrics that were provided. So just for my own clarification then, assuming, let's say for a second, hypothetically, that you could test every kid every day, roughly 800 kids, an 8% positivity rate would be 64 kids. So what they're saying is that anything less than 64 kids testing positive is okay to keep school open. Am I hearing that correctly?
They are saying positivity rate for the community, because really what they're monitoring is community spread.
Right.
So they're looking at the positivity rate in the greater community. And the interesting piece about that data is obviously the more tests you do, the lower the positivity rate is. And so at the beginning of this crisis, there were many communities there were some communities in Lake County up at 50%, outrageous positivity rates, because we were only testing folks with very serious symptoms who were definitely showing signs of the illness. And at this point, we are testing more folks. More people are going for the testing when they feel that they've been exposed or are nervous about it. And so the positivity rate is going down. But yes, the threshold that they are really measuring is again for the greater community. And that's where they've broken us up into regions. Whether or not that would translate into 8% of a school community, or they would feel that would be the same, I'm not sure. But that's
the latest I saw for Lake Bluff, the incorporated piece of Lake Bluff had roughly 35 or 40 cases, and unincorporated added another 100 cases or so. And many of those existed in the nursing home or the care facility in West Lake Bluff. So even if you take with 6,000 residents, 100 or so positive cases, we're still well below 8% in this area. So what you're saying though is it's a conglomerate of all McHenry, District 9 or whatever this area 9 represents, McHenry County and Lake County.
It is, that's true. And the positivity rate, from my understanding at this point, the positivity rate that is on the regional statistics on the Illinois Department of Health is actually, it incorporates all the cases all the way back to the first case, which is in March at some point. And so it really isn't a true picture of a really current picture of what the positivity rate is. And again, that rate is the number of positive tests out of the number of tests, not the population, which is a little bit different. But their threshold for that is still the 8%.
Okay, so that brings me to my question. How are we going to track this metric day to day, week to week?
So that we are relying again on the Department of Health to help us with that.
But the numbers that they provided are old.
That's right. And so again, we're looking for, superintendents have been asking for a dashboard that's more current, that really gives us an actual 7-day average and also breaks it down by zip code. We've been told that that's coming soon as potentially early next week. And that's something that each community is really going to have to look at in terms of the context of their district, because obviously our ability to stay in depends on that context and depends on our ability to have the community at a low community spread, so that we know that when kids come to us, there's a low likelihood that they've been exposed. Now, we also know that our teachers are coming from all different regions. And so that is a different metric that we've also been asking the Department of Health for guidance on, and that's not one that they have an answer for us on yet. But again, we're asking all students and staff to self-certify every day. Anyone developing symptoms or exhibiting any symptoms during the day will have to go home. So again, we are relying very much on the community to be honest with us and to keep students home when they aren't feeling well. And that is why we're trying very hard to have a system where if a student does stay home for a day or two, that they can still participate in remote learning and not feel like they're getting behind.
Yeah, important. So Lisa, what will happen if there actually is a positive test for somebody who's been in the school?
So a positive test in the school would result in a call to the health department, and we would need to provide them with information on that student. The positive case would have to come to us from the family or from the student. Potentially it would come from the county health department. I don't know that always happens, but we would call them, and then we would begin giving them the information that they need for contact tracing, so that we could have the students that have been, and students and adults that have been around that child in what they call close contact, which is less than 6 feet for more than 15 minutes, masked or unmasked, prior to 2 days prior to symptom onset or 2 days prior to the positive test. Which is why school is going to look so different too, when you're in person, because we are going to have seating charts and know exactly where every child is every single minute of every day, so that if that happens, when that happens, we will be able to provide the health department with those names and be able to have those folks quarantine.
Okay, so as a practical matter then, if a teacher or a student gets a positive diagnosis, then that classroom we can assume will go entirely remote? What about the rest of the school?
Generally speaking, yes. Generally speaking, yes.
Okay.
But that's again why we're trying to build a system where that classroom can start remote learning quickly and transition seamlessly between. Yeah.
Right. Okay. And Jay, I heard you say that you expected there to be $250,000 of pandemic related costs, but there would be offsets in other areas. What do you expect the net to be?
Well, so for example, there are sources of revenue. We'll be talking about the Lake County intergovernmental agreement a little bit later in the meeting, where they're sharing some of their federal relief money with individual taxing bodies. So I do see some potential revenue offsets. I think we actually talked today about stipend positions, and we will see, we are actually adding additional positions for areas that we need additional help with. So we may be paying staff to do things that they don't normally do, but we will be saving money in other areas. For example, sports, in-person sports are not likely to happen this year, and there's a significant cost for coaches for sports that we would be saving. So there's, it's hard to put a number on it, but those are some of the examples of savings.
Okay. And I apologize if I missed this, but what will teachers be in classrooms every day? Sometimes being, or maybe sometimes being teaching in person and sometimes being projected remotely? I mean, where would the teachers be in all of this?
I need to unmute myself. Yes, so some of our teachers will be working remotely from home. We have been working with our teachers to make sure that teachers who have underlying medical conditions or medical concerns in their home or people that they care for would be able to work remotely off-site. The rest of our staff will either be working remotely within our buildings if they are required to have limited contact with children for a reason, or they will be teaching in our building with children. So our staffing assignments are one of those three.
Do we have a sense of what percentage of teachers will actually be in the classroom with, or in the school at all versus remote? Do we have any sense?
It's a fairly small group that will be working offsite. It's about, I think we're at about 10 to 15.
Oh, that is good.
But again, some of our staff are required to have limited contact, so they will be remote, but in school. And they'll be, you know, Zooming or presenting their lessons from an office in school. And then we have some teachers who will be with children. And again, that's assuming 100% workforce, you know, and that nobody is sick or needs to be quarantining, and that will change as the year progresses, and we may have more teachers working off-site at that point.
How are we doing with the pool of substitute teachers?
The pool is smaller than it's been, which is partially the reason for our shortened school day. We are trying to allow ourselves some flexibility for teachers to help each other, because we know that subbing has been an issue in the past. But we will be contacting we have contacted our substitutes to find out their preference, whether they can sub in person, whether they would be comfortable with remote. And we will be inviting our substitutes to join us for a portion of our Institute Week to learn about our procedures. It's a challenge to get subs anyway. This is probably going to be a difficult year.
Well, and a lot hinges on having those people. When I think about the complexity of the plan that you have put together, I really appreciate the thoughtful, you know, and participation from different groups of people. I really, really appreciate that. But I'm concerned too, because I can hear that there's so many layers of things that need to work, from the extra rooms to quarantine people to, you know, substitutes if people are out being quarantined or actually, you know, not feeling well. It's a lot.
It is a lot. Yeah, it's a complex issue. And like I said, even made more complex by the guidance, you know, kind of as we're all struggling to learn more about this virus and how we can contain it. Many people are working very hard to figure these things out. And it's been a challenge to keep up with that and to integrate it and to continue to integrate these pieces into our plan. And at some point, some of these metrics may make it very, very difficult to sustain what we're trying to do. But our guidance at this point right now is to bring students back if we can and do it as safely as we can. And that's the goal that we're trying to achieve.
Lisa, I have one other question. Let's assume for a second that the positivity rate goes beyond what allows us to keep kids in school and you have to quickly go to remote. Do you feel confident that we're, based on the experience in the spring and the work you've done this summer, set up to seamlessly move into that remote capacity for both kids and teachers?
That is the plan. I mean, we will have students on that platform anyway. So hopefully the kinks will be worked out, if there are any, prior to having to shift entirely to remote. But we're planning on having a really robust and effective remote learning program from day one for the students who are learning at home. So I do anticipate that it will be much more seamless than it was in the spring. And I wasn't here, but I know it was hard for everyone. And that was just a very difficult shift. But it shouldn't be anywhere near as difficult as it was in the past. Our teachers are preparing, they're planning for it to be, like I said, a great experience from day one. And again, too, the other piece is, yes, the threshold is 8%, but we'll be looking at that every day and monitoring. And when we're getting close and we're seeing it, we're going to start to be making those decisions in-house so that we can shift and transition and do what we need to do seamlessly.
I got a question. Are we doing, as part of the professional development that you've got, I think 4 days set up before school starts, is there any training for teachers on, I'm not sure if there is such a thing, but as in terms of best practice and remote learning? And are also tagged onto that, are we doing some kind of a dry run to make sure all this, everything we're dreaming of will actually work prior to actually the first day of school?
Yes, so actually we have 5 days of institute time. The 4 days will be next week, and then we'll have one additional day on Monday, August 31st. And so the 4 days will be a lot of time spent in teacher teams with some professional development. We actually have a teacher work group that has been working on providing some tips and some best practice information to staff. They've been collaborating to create this kind of living dynamic document where teachers and staff can share with each other best practices, and that work will continue throughout the year. And then in terms of a dry run, we'll be looking at Monday the 31st to be trying to do some of that. It'll be different when the kids get there, and that's for sure. You know, we know the first day of school, right? We know that the first day of school is a really exciting time, and it's always a little bit difficult to get those plans moving the way you anticipated that they would, but I believe we'll be able to make it happen.
I have an additional question. This is kind of a broad question, perhaps a comment as well, having to do with safety in general. You know, as a parent, although my kids are no longer in school, I can really relate to, I can imagine the struggle that parents have making the call to have their kids stay at home or have their kids go to school or do a hybrid. And I can appreciate that there's a million different reasons why one circumstance works for everyone, for different families. And we've talked a lot about the things we're doing to try to keep our kids safe. I also have family members who are teachers, and I know they are struggling, not locally, but places across the country. And I know they're struggling with what schools are asking of them right now. And I just wanted to ask, you know, in your opinion, are we doing everything we can do to keep our staff and our students and our administrators safe when they're in these buildings? And is there something that, if you were to dream big, you would ask of your board to give support to try to do in addition to what we're doing now?
I appreciate the question, and I think I can't agree more. This is an incredibly difficult time to be an educator. We did not sign up to be on the front lines of a health crisis of this magnitude, and we have now been classified as essential workers on the front lines. And I appreciate that you ask kind of for us to dream big. We actually have been dreaming a little bit big about what we could do. As we learn more about this particular situation, you know, there is an aspect of it that is coming to light that has to do with increased ventilation and making sure that we're keeping our air in the best possible condition that it could be. And I'm gonna, if he feels comfortable, I'm gonna let Jay talk a little bit about something that we've been discussing that we were planning on bringing to the board a little bit later, but we're happy to introduce it now.
Sure. In talking with our architects and engineers about recommendations for making sure that the air in the classrooms is as healthy as possible, we've implemented all the recommendations that we can do with our current system. So we are increasing the capacity, or putting in finer filters to increase our filtering capability, increasing our fresh air intake to between 30 and 50%, so recirculating outside air. One of the recommendations also was something called bipolar ionization, which is a system that goes in your ductwork, and it effectively ionizes the air and creates positive and negative charged particles that I believe either kill viruses or bacteria, or make it positively charged so that it's easier to filter out. And the benefits of it are that it improves air quality in general. So it works with any particulates, with ozone, and as well as bacteria and viruses. So it it also gives you the ability to install air quality monitors that can easily be read and show or demonstrate whether the system is working or not and what your air quality is, so you can measure the impact of it. And we've been considering implementing some or all of these systems in our HVAC systems. I think to do all of the systems to the greatest extent possible with the appropriate monitoring equipment would run about $250,000. So that's one of those big capital expenditures that I was alluding to, where that's not included in the just the base expense of running the school, but that would be something additional that I think would really make both community members and teachers, with kids in the building, teachers who are in the building and administrators who are in the building, feel more confident that it was a healthy environment, and it would pay dividends in the future because it would improve air quality in general. So after the pandemic, you have normal flu season. I think it would keep incidents of, flu outbreaks down, as well as just improving air quality for things like ozone and particulates on, really hot days and things like that, where they have air quality warnings. So it would just improve air quality overall in the schools. So that's something that we had been talking about. It's not something that you need to do all or nothing. You could install monitors first and then install the ionization equipment later, or you could install it in maybe a more higher risk areas, like maybe you wouldn't do the gym because it's a big open space, but you would do offices instead in order to make the cost more manageable. So those are some of the variables that we'd be looking at.
I have a couple follow-ups on that. I'd be interested, and I don't want to put you on the spot because we've already put you on the spot right now, but if you do decide to bring that forward to the board as a proposal, I would definitely be interested in seeing some research-based science support for that to show that it is something that is effective. Also, if and when you decide to come forward, if you could ask the question about lead time. What are we talking about? Is this something we can get in place in a month, or is it not for another, how long does it take to order it and get installed?
Yeah, and those are some of the things we're working on. It's why we haven't brought it forward yet. But, I do have some literature that from our engineers looking at, the science behind it and the efficacy, and then lead times. I think ideally, in the summer, fall, you can leave the windows open and really bring in outside air and ventilate well. And during the winter, it's a lot harder to do that. You don't have the opportunity to go outside, and it's hard to keep the windows open and still maintain a comfortable environment temperature-wise. So hopefully, if we started on the project now, this would be something that we could have in place by the winter. But again, I've not researched. I imagine these systems are in higher demand, and I don't want to speak prematurely.
Sure.
We'd have to look into what the lead times are for installation and ordering of equipment and things like that.
Right. Okay.
Thank you for asking.
Any other follow-up questions?
No, I just want to thank all of you for putting together, again, a very well thought out plan that honors, it looks like, the preference for most of the community to have some in-school opportunity. I know there's a lot of people that think that's important. I'm one of them. And I know it's not easy now. It hasn't been, and it certainly doesn't look like it's going to be, but thank you for accommodating that and putting all of this together. So well done.
Thank you.
Yeah, I'll second that. I think we're the only district that I know of, at least, that has a full in-person option, a full home option, and a hybrid option. And as a parent, I appreciated the choice. And I think just from hearing from community members that, there's no perfect solution for everybody, but we're, I think, close to being able to provide the best we can in that regard. So thanks to the admin team and Lisa for all you guys have done, because I know it's burning the candle for sure, getting this into a safe spot. So thanks a lot.
So I would like to make sure that if there is any public comment regarding this presentation in particular, we make that available. I don't think I saw hands raised, but I'll check again.
There aren't any hands raised, but while we're waiting, if you wouldn't mind me mentioning one other piece that we have been talking about as a possibility for a large expenditure, and that would be providing COVID testing for staff on a regular basis. And we have been looking at partnerships with hospitals or kind of banding together as the districts who are doing an in-person experience to provide some of the rapid testing to our students and staff if they would like that. It's not something that we would mandate, but it would certainly help us to set a baseline. And so we've been working on that for some time and have been soliciting some donorship to try to support us with that, because that is something we would need quickly. And it is something that we think could provide a level of comfort. We know there's some downsides to the rapid test. The upside is that you get the result in 15 minutes. And there are more likely false negatives than false positives. But again, it could help us with contact tracing. It could help us set baselines after long breaks or times when folks have been away. So that is another piece that we're looking at, but it would be a large expenditure. And so we are again soliciting some funding from other places as well.
So this might be a good opportunity, given how many thousands of people are watching, to let people know that if there are any individuals or corporations interested in partnering on such a program, to reach out to Dr. Leali at Lake Bluff District 65 to have that conversation.
Yes, thank you. I don't see any hands up. Shelley, any comments that have come in? No.
No? Okay. So not seeing any further need for comment at this point, I'm going to move on to item 5B, which is Mr. Khan is going to talk about the Lake County CARES Intergovernmental Agreement.
So,
Can't hear you, Jay.
Better?
Yes, a little echoey, but better.
Lake County, so the district received some coronavirus federal relief that was distributed through the Illinois State Board of Education. And it was as a result of the CARES Act. Lake County, the state of Illinois and all of the counties in Illinois also received CARES Act relief money. And Lake County has elected to share a portion of that money with all of the taxing bodies within the county. And so in order to do that, they're asking us to complete an intergovernmental agreement, which essentially just lays out the rules for receiving the money, explains what, and gives them some audit capability, and protects them because there are federal rules and about how the money can be spent that they're required to follow. And so it basically just asks us to promise to follow the same rules. So in order to get this money, we would execute this intergovernmental agreement, and then once it's approved, we would submit expenditures for reimbursement to the county, and their finance department would review them, compare them to the guidelines, and we would be reimbursed up to $29,000. So that this would be some additional revenue to offset some of the expenditures related to COVID and opening schools.
Good. Free money is a good thing.
So you'll be bringing this in at the end of the month for approval, and it's in your board packet for review.
so the cap's $29,000?
The money was allocated based on student population. So they set aside a certain amount for school districts, and then it was just allocated based on student enrollment. So that was what our share came out to be.
Any other questions for Mr. Khan on this? Any other public comment now that we draw to the end of the meeting? Any comment from anybody in the audience, or anything been emailed to us or put on our Google document? Don't think so.
No.
Any other issues or comments from the board? Thank you for all of your hard work on this plan, your team, your administrators, your teachers. We appreciate all the many, many hours that you guys have put into this and doing so much for the community. It goes, we definitely are noticing and very appreciative of all the work that you guys are doing. So thanks. So if there's no other comments or questions, I'm going to call for an adjournment at 8:11 p.m. Do I have a motion?
So moved.
Second?
Second.
We do need to take a roll call because we are under emergency orders. So roll call vote, please.
Leanne, you're muted.
I think I'd get that by now. Hill,
Hill?
Hill, called you.
Ann Hill.
Yes, I'm frozen. I don't know if you guys can see me, but I say yes.
Okay, good. Duran,
Yes.
Gottschall,
Yes.
Sarlo, yes. Barry,
Yes.
Morrison.
Yes.
All right. We are adjourned. Thank you. Good night,
Thanks,
guys.
Good night, everyone.
Get that mask
Night.
off, Lisa and Jay.
Good night.
Yeah.
Thank you.
See you later.